Just more than a year ago, I spoke to Raleigh therapist and nurse practitioner Jessica Sparrow. What she told me then still remains true today.
The biggest problem that I've had is finding a supervising physician for another nurse practitioner to hire.
Which means she doesn't have room for any new clients. Nurse practitioners and certified midwives are included among the professions that are required to have a supervising physician. They only meet with them twice a year, and it's expensive. The SAVE Act removes the requirement. State Representative Gail Adcock is also a nurse practitioner and a sponsor of the bill.
So that they can do everything they're already doing, but without this kind of check-the-box paper physician supervision that's actually meaningless, doesn't add any value to the care they give.
While the SAVE Act has been stuck in committee on the House side, it's now moving forward in the Senate.
This is one step in many steps that need to happen for this to come into realistic fruition.
Adcock says the access to health care crisis is the top reason the bill should pass, because the gap could be filled by qualified providers other than physicians.
We have counties that have no primary care provider. We have 30 counties that have no obstetrical provider. I mean, we're in a terrible place.
Sparrow says the same problem exists for nurse practitioners who want to provide mental health care in less populated counties.
Some of those counties don't have psychiatrists at all. And so that would really be a big barrier removed for, those nurse practitioners that own businesses or work in clinics where, they like to hire somebody else, but don't have the supervising physician piece in place.
This is not a novel idea. It's not something new. And we know that it works because over the last 30 years, 26 states have done it. Not a single state has ever repealed this legislation. No one has ever walked it back and said, well, that didn't help. That made things worse.